The end of summer brings the new school year, and it may also bring a new spike in COVID-19. Cases and hospitalizations have been rising across the United States in recent weeks. One way school officials have been looking to keep students and teachers safe is by improving the air quality in the classroom. But many of the nation's school buildings have out-of-date ventilation systems. Joseph Allen has long advocated for healthier buildings and directs the Healthy Buildings program at the Harvard T.H. Chan School of Public Health. And he joins us now. Professor, before we get to the specifics of COVID, first let's introduce people to the idea of a healthy versus a sick building. What do those terms mean?
Yeah, sure. So thanks for having me on, John. Most people don't realize we've been in the sick building era, and it's by design. So what I mean by this is the way we've designed and operate our buildings hasn't been based on the latest health science. We've underventilated them. We've choked off the air supply so much. And this has been a big problem for us, particularly when COVID hit. You have buildings that essentially don't breathe, and you have a respiratory virus that transmits entirely indoors. And this has been a major problem. In fact, it's been a problem for our schools, offices, everywhere we spend our time are underventilated. We're not bringing enough outdoor air, and therefore we've created this sick building era, and we're trying to advance this into the healthy buildings era, where we start to design and operate our buildings according to the latest science on how to improve these spaces for our health and our well-being.
And so in classrooms, how do you do that to make the building healthier?
Yeah, fortunately, it's really straightforward and not all that expensive. I was a commissioner on the Lancet COVID-19 Commission, and we wrote a report called The First 4 Healthy Building Strategies Every Building Should Pursue. Really straightforward, really simple. The first is give your building a tune-up. If you own a car, you know you have to do this every year to make sure it performs right. We need to do the same for our buildings. Good news here, it helps improve indoor air quality and saves money. So it's a cost neutral after just a few years. Second thing, bring in more outdoor air. Bring in as much outdoor air ventilation as you can. Third, improve filtration. Most buildings have what's called a MERV 8 filter, captures maybe 20% of airborne particles. Upgrade to a MERV 13 filter, which gets you to 80 or 90%. Last, you can use these portable air cleaners with HEPA filters. They're great plug-and-play devices. And on top of that, you want to do something else, you can measure indoor air quality. There are now low-cost air quality sensors that'll tell you how your space is performing. Measure things like carbon dioxide and airborne particles, so then you can see if something's off and make the appropriate correction.
So for all kinds of things in the air, not just COVID. So billions of relief funds were allocated during the height of the pandemic emergency. How has that money made its way to this effort?
Well, I have to tell you, John, people are going to be shocked to hear this. We allocated about $200 billion towards schools, and the majority has not been spent. Hundreds of billions of dollars allocated during a crisis when tens of millions of kids were out of school, and most of it has not been spent. That is shocking. And here's the good news. It's very easy to make these improvements to the school building, and we know there are massive benefits that go way beyond COVID. So if you improve indoor air quality, it helps reduce COVID risk, helps reduce influenza risk and RSV risk. On top of it, we know schools that follow these healthy building strategies, kids perform better on reading tests and math tests. They're absent less often when you improve indoor air quality. These are also the same strategies that work against the threats we saw this summer and into the fall and last spring, extreme heat. So we can improve the air conditioning in these buildings against wildfire and outdoor air pollution, which penetrates indoors. You improve filtration for COVID, you also protect against outdoor air pollutants. So we tend to think of these in silos, but these healthy building strategies provide many benefits to students and teachers and staff in the building.
So, Joe, if it's not that hard to do, not super expensive, better health outcomes and better schooling outcomes, what's up? Why hasn't this money been spent?
I wrote a book called Healthy Buildings, trying to draw attention to this. It's stunning to me. It's a total fail. Honestly, we had a virus that spread indoors in these underventilated, underfiltered locations. We knew exactly what to do. We wrote guidance in the summer of 2020. The money was made available. The schools that got it done decreased their risk by 50 to 75%. Many schools are still sitting on this money. I think the buildings are an afterthought. Look, I'm a parent of 3 kids. You think about return to school. What do you think about? The teachers, the busing, the meals. Very few people think about the role the building plays on their kids' success. One study in New York State showed that the likelihood of failing a standardized test was 10% higher if the kid took a test on a day that was 90 degrees versus 75 degrees. So the school building is influencing kids' health and performance in many, many ways. COVID influenza, but also extreme heat, air pollution, and just general well-being and performance and performance on math tests, for example. So this is an absolute no-brainer. It's not rocket scientists. The guidance is out there. We know exactly what to do, and the money is still available.
Well, let's hope people will pay more attention now. Joseph Allen with the Harvard T.H. Chan School of Public Health. Thanks so much for being with us.
Thanks for having me on, John.